You can believe it, we're already officially 1 week into the new year, and for so many people, prioritizing physical health pretty much always lands the top spots on the list of New Year's resolutions. That could include taking on a new fitness routine or maybe upping the ante on the current one. Experts say they are seeing a surge of injuries at the start of the year, including orthopedic surgeon at Orlando Health, Dr. Andrew Carbone. Dr. Carbone, good morning.
Good morning. How are you?
Doing great. Like so many other people, fitness is on the top of my New Year's resolutions list this year, but we know so many people are going from the gym to the exam room. I hear you're calling it the fitness frenzy fallout. What exactly is that?
Absolutely. We see a predictable spike of really preventable injuries every January around this time. And it's really people that go from doing very little or maybe haven't worked out at all to seeing some videos and wanting to get out there and really try and improve their fitness health. And, we're calling it the fitness frenzy fallout just because it's such a set of preventable injuries that we can treat. And in my practice, it really does spike around this time of year here in Orlando.
What are some of the most common injuries that you're seeing this time of year?
Usually it's shoulder and back injuries. And shoulder because we always try and lift. Maybe we can think we can lift more than we actually can. And lower back injuries because a lot of times, we're not using proper form, or maybe we forgot some of that form. We forgot some of the ways to lift, and we try and pick up weights in a way that, puts more strain on our back than we really need to.
Okay.
And so those are kind of the two biggest ones.
All right. Yeah. I can imagine your core got maybe a little bit loose during the holiday season with all like the treats and stuff everyone's eating. And you did mention videos that people are seeing online. How are social media fitness challenges getting incorporated into all of these injuries?
Yeah, there's a ton of challenges out there and trending things. And a lot of them really focus on dramatic transformations and ways that we can go from kind of 30-day challenges or whatnot to really shred body fat and all this stuff. And, it's really problematic because while we want to focus on fitness and it's important that we focus on working out and things like that, I think a lot of times the context is missing. And, we don't talk about warm-ups, and we don't talk about proper technique and consistency. We focus more on results. And I think that's usually a problem, especially among younger people.
Yeah. Can you talk about, when you talk about consistency, how long should people be setting their goal markers for? I mean, I would imagine one of the most common mistakes is imagining you're going to step foot into the gym tomorrow and be where you want to be in a week.
Absolutely. Yeah, no, we want to be setting 6 month, 8 month, 1 year time horizons, not 30-day check. And we want to make small changes in our routines. Really, it's all about maybe 2 days a week, 3 days a week, even just going to the gym, even not even working out, but just incorporating the idea of going there is important, because once you're there, you're going to slowly build. What we don't want to do is go really intense, really quickly, and then burn out really fast, because that's not the purpose of what the New Year's resolution really is about.
You touched on this a little bit, but what usually is the guideline that you present to people when they say, I'm ready to start a brand new routine? Maybe they've never stepped foot into the gym before.
Yeah, so I would say no more than 3 days a week to start. Okay. Incorporate rest into your workout regimen. Our tendons, our bones, they're all healing while we're resting. So while we're getting that strong workout, we need that same amount of time to let ourselves build that muscle back. And so incorporating rest into part of your routine, not going more than 3 days a week, is going to be important. And then obviously listen to your body. If something's hurting while you're working out, we want to avoid that. Obviously soreness is can be good, but pain that changes the way we move or pain during our workout is not good.
Okay, yeah, and we're running out of time here, but I'm glad that you touched upon that because, people always say you got to push through the pain to a certain degree. When is that not the right move? When should you be getting a doctor's opinion on that?
Absolutely. So if you're having pain while you're working out, or you're not able to complete a workout the way it's supposed to be done because of pain, you really should come see us. We have walk-in clinics available for that sort of thing. We want to avoid, pushing through that sort of pain. Soreness after the workout, totally normal. Pain during the workout is a problem.
All right. That is good to keep in mind as so many of us start hitting the gym on a more regular basis this year. Dr. Carbone, thanks for joining us this morning.
Thank you for having me. I appreciate it.